We are live now, and I would like you all to switch on your videos, please. Especially Dr. Sam, I would like to see you.
Hello, Ajua. Hello, everyone. Am I being seen now?
Yes, we can hear you. Thank
Good.
you. So, hello, everyone. Thank you so much for joining us and for your patience as well. My name is Ajua Good, and I am the program coordinator for Gap Health Technologies in the Gambia. So Gap Health is a telehealth company whose operation extend across Ghana and the Gambia. At Gap Health, we are passionate about using technology to make healthcare more accessible, efficient, and innovative, especially for communities that need it most. And through our Gap Health patient and provider app, we help people to book virtual consultations with trusted healthcare professionals, make their health records right, manage their health records right from their phones, and also to take real steps towards living healthier and more informed. So our goal is to empower people to take charge of their health anytime and anywhere. If you would like to learn more about what we do, please visit our website at gaphealth.ai or send us a message on WhatsApp at 220 plus 220-729-7967 or plus 233-594-11885. Now I am honored to welcome our guest speaker for today's session, Dr. Pa Samba Seka from Edward Francis Small Teaching Hospital. Dr. Seka is a dedicated healthcare professional whose expertise and commitment to patient care make him an invaluable voice in today's discussion. Dr. Seka, we're so grateful to have you here and for taking the time to share your knowledge with us. Before we dive in, could you please tell us a little bit about yourself and your background?
Thank you very much, Ajua, and I am grateful to Gap Health for this opportunity. My name is Pa Samba Seka. I am a surgical resident. That means I am still doing my specialization in surgery. So I'm a member of the West African College of Surgeons. Now, in our field, you do membership, which brings you to the family, but then you would have to go further and do further specialization, which I am currently doing in pediatric surgery. That means surgical conditions that affect children. So actually, I was carried away by work. Somehow I thought this program is starting at 3:30. And when you called, I was actually attending to a patient. So I had to do that quickly and leave it with somebody to run over and start this program. So my apologies to everyone for starting late.
It's okay. Next time I'll let you know 30 minutes before time again to remind you.
Thank you.
But we are so happy to have you here though.
Thank you.
You're welcome. So our conversation today focuses on a topic that affects women not only in the Gambia and Africa, but all around the world, which is called breast cancer. Breast cancer occurs when a shell in the breast grows and divides uncontrollably and forming a lump or tumor. So it's one of the most common concerns among women globally, but the good news is that early detection and treatment can save lives. In many parts of Africa, including the Gambia, awareness and access to screening are still limited, which often leads to late diagnosis. So this is why conversations like today's are so important to educate, to raise awareness, and to empower people to take action for their health. So our discussion today will run for 15 minutes, followed by 10 minutes question and answer session where you will have the chance to ask questions directly to Dr. Seka. And we encourage everyone joining us on Zoom and Facebook Live to participate, share your thoughts, your experiences, and your question. And aside from that, please let us know in the chat box, especially on Zoom and Facebook as well, what you think we should do next and what you would like to see done differently. Thank you once again, Dr. Seka, for being here with us. So before we dive into the details, you have been serving patients and working in healthcare for many years, especially at Edward Francis Small Teaching Hospital. You've gained so much experience, which plays such a vital role in our healthcare system. Could you please start by telling us a bit about what inspired your journey into medicine and particularly your interest in raising awareness about breast cancer?
Right. Thank you very much. That is a very, very important question. So I started off, I think it was just an instinct that I had in me. When I was growing up, I always had the idea of becoming a doctor. I don't know what really inspired that. But then as I grew up, to be honest, I fell in love with the profession. And I was always taken away by how much dedication doctors put into patients' care. And I always admired the work that they do. So, growing up, my dad also somehow saw that I was into the sciences, and he did encourage me. So when I went to high school, I just did science. And after that, I applied to the University of the Gambia Medical School, and I was accepted. That's how the journey started. So helping patients, basically, because we are taught that if you save one life, you've actually saved, it's like you have saved an entire nation. So that's how important it is. So imagine having an opportunity to save several, let's say hundreds or even thousands of lives. I think that is a very, very, very rare opportunity that we are very grateful for. So basically, I think that's what inspires me, if not for the fact that there's always been that instinct in me.
So to the patients, please feel comfortable to reach out to the doctors, go to them, because that's what they want, to help people. So you've had it from the horse's mouth, right?
So there's nothing that makes us happier than helping patients.
Right,
honestly.
right.
Yeah.
So in your experience at Edward Francis Small Teaching Hospital, what are some of the common misconceptions people have about breast cancer?
Okay, so let's start by clarifying that breast cancer is, like you said, a very dangerous disease. So it's caused by the uncontrolled growth of cells. So every part of our body has cells, actually. So that does not exclude the breast. So when the cells in the breast are growing out of proportion, because they're supposed to grow, but when they have an uncontrolled growth and they grow out of proportion, then that is where the problem comes. And people have to also realize that men do have breast tissue. So it's not just as much as in women, but men also have breast tissue. So the first misconception people have is that men cannot have breast cancer. Yes, they are at risk, or their risk is far lower than women, but they can also have breast cancer. Now, some people think that once you are diagnosed with breast cancer, that is the end of your life. And that is a misconception, because maybe we will get to that, but many people have actually lived with breast cancer. And it's always our slogan that early detection saves lives. So the earlier you catch it, the better your chances of recovering from it are. And people need to know that as well. Some people also have this misconception that breast cancer is not treatable in the Gambia. We have seen patients who have survived from breast cancer. We have seen several patients who have been treated, and they did well. And they've actually been discharged, and they've been seen on follow-up, and they're doing very well. So that is something that people need to understand. Now, breast cancer in the West, it affects elderly women mostly, right? Women in the ages of 60, 70. So people think that it also applies to the Gambia. Now, we have the reason why I am saying this is because we've actually seen patients who are about 30, 20 years of age, and they come with breast cancer, okay? So there is a misconception that it cannot affect younger women. It can, and it is affecting younger women, especially in the Gambia. Some people think that it is only familial. That means you cannot get breast cancer if it doesn't run in your family. That's what some people think. That is a misconception because there's what we call sporadic diseases. It means it just happens randomly in a family. You know, maybe you don't even have a mother or sister or an aunt who has breast cancer, but it just happens like that. So people have to understand that it's not only familial. It's not only people who have family history of breast cancer that will develop breast cancer. Now, some people also think that if you don't have pain on your breast, then you don't have breast cancer. Actually, that's one of the reasons why it's difficult to catch it early, because most breast cancers are painless. You know, they don't have any pain. They have other symptoms or other changes on the breast, which we will talk about later. But the absence of pain does not mean that someone doesn't have breast cancer. Actually, it's the other way around. The painless masses are more likely to be breast cancer than the ones that are painful. So it's in our tradition, you know, whenever you have problems on your breast, they will tell you that it's the baby, especially for those who are breastfeeding, they will tell you it's your baby that grew up on your breast. That's why you are having this. But these can be misconceptions. And one thing about breast cancer during pregnancy or breastfeeding, maybe it would have started during pregnancy, and by the time you have given birth, it's already very, very bad, right? So people who are pregnant are even more advised to seek help when they see changes on their breast that were not there. Yes, pregnancy comes with breast changes, but these breast changes are supposed to be symmetrical. Like what that means is what happens to the left breast should happen to the right breast. But if you see changes in one breast particularly, then you have to take charge and see a doctor as soon as possible. So there are many misconceptions, but I think these are the few that are very, very pertinent to our environment.
It's interesting. I've actually learned something new today. So for a layman to understand, like, what exactly is breast cancer and how does it develop?
Right. So cells in our bodies have controlled growth. They grow. They are supposed to grow. That's why we come into this world as babies, and then we grow gradually to become preschoolers, we become toddlers, we become adolescents, we become adults, etc. So cells naturally grow. However, this growth is controlled. There are programs in the cells, in the body, that control the growth of these cells. Now, when breast cancer happens, it is because this control of growth is no longer there. And so these cells are now free to proliferate, to reproduce, to multiply anyhow they want. So they keep multiplying and multiplying and multiplying until their sizes become bigger, and the function that they were supposed to carry out, they no longer can carry out those functions. So basically, in a layman's term, that is what cancer means. It's uncontrolled growth of cells. The cells just keep growing and they are not stopping. So there are mechanisms in the body that are put in place to keep them in control, to check them, right? So, but when these mechanisms fail, then breast cancer would happen. Now, sometimes it can be at a molecular level, what we call mutations. Okay, so cells were supposed to go or look like certain ways, and somehow they change. Right, so that's also one of the ways why how breast cancer happens. So basically, that is what breast cancer is. It's just the uncontrolled growth of cells in the breast. Yeah.
Wow, that's interesting. So are there particular risk factors people should be aware about, and things like lifestyle, genetics, or age?
Yeah, so that's very important. Now, when it comes to risk factors for developing breast cancer, broadly, we categorize them into two. So we have what we call modifiable risk factors and non-modifiable risk factors. The modifiable risk factors, these are the things that we are in control of, meaning we can decide to live in certain ways, we can decide to do certain things. The non-modifiable risk factors are those things that come naturally. You and I have no say on those kind of things. So the non-modifiable risk factors, for example, include age. Okay, so we say that the older one gets, the more risk they are, or the higher the risk of them developing breast cancer. So that's why we say mostly it's a disease of the elderly in the West. But like I said, in our settings, we do see breast cancers even at the age of 20 years. But usually the older one gets, the higher their risk of developing breast cancer. So that's a risk factor. It's a non-modifiable risk factor because we cannot do anything about age. We can't stop getting older. Then early menarche, and that has to do with the reproductive system for women. Early menarche means the age at which somebody starts to see their menses is early. And so most of the time, people would start seeing their menses at the age of 12, at the age of 13, 14 years. People have different ages of menarche. But when somebody starts to see their menses at a very early age, let's say by the age of 9 years, by the age of 8 years, it means that their bodies are exposed to hormones for a long time, right? So because if they start seeing their menses, let's say at 10, and they live up to the age of 60, it means that, and let's say they had menopause, that means they stopped seeing their menses at the age of 50. It means for 40 years, they've been seeing their menses. And the more you are exposed to the hormones that are responsible for menstruation, the more risk you are having for developing breast cancer. So people who have a late menopause as well is the same principle. Late menopause means the age at which you have stopped seeing your menses is late. So let's say 60 years, you were seeing your menses at the age of 10, and you continued seeing them up to the age of 60 years, it means you are at risk of developing breast cancer because of the gap, because of that long period your body has been exposed to hormones. So these are all non-modifiable risk factors. We cannot do anything about them. Also, we have the issue of family. Okay, so sometimes it runs in the family. So if you have a mother or a sister who has breast cancer, then you are also at risk of developing breast cancer. So there is nothing that you could do about that. It's your mother who has breast cancer. You can't change your mother. It's your sister who has breast cancer. You cannot change your sister. So these are the non-modifiable risk factors, okay? Pregnancy is known to be protective because when one is pregnant, then they don't see their menses. By the same logic, they are less exposed to these hormones that are responsible for menstruation. And so it is found out to be protective. You know, I mean, that means, I mean, the number of pregnancies that one has. So for example, if somebody has one pregnancy compared to one who has 5 pregnancies, the one who has 5 pregnancies is actually more protected from developing breast cancer than one who has just one. So it also means that people who have never been pregnant in their lives also at risk of developing breast cancer. And sometimes these are modifiable, these are non-modifiable risk factors. Sometimes we cannot determine who gets pregnant and who doesn't get pregnant. So that's why we consider it to be a non-modifiable risk factor. Now, when it comes to the modifiable risk factors, these are the things that we have control over. We decide on how to, let's say, eat, right? So our eating habits is something that is modifiable. So if someone eats a lot until they become obese, it's been found out that obesity is a risk factor, not only for breast cancer, but for many other illnesses or diseases. So when people decide to always overload themselves with food until they become overweight and eventually they become obese, they are putting themselves at the risk of developing breast cancer. Then the other modifiable risk factors include alcohol. Alcohol is also known to be a risk factor for many, many diseases, breast cancer included. So people who have sedentary lifestyles, right? So they don't want to exercise, they're always at home enjoying turning on the AC, you know, they're watching TV, maybe the remote control is just next to them. They would have to call somebody who is playing outside, or even take their phone and call somebody who is in the next compound. Leo, come and give me the remote control, which is just next to them. So sedentary lifestyle is also known to be a risk factor for breast cancer. Then hormone therapy. So some people use hormone replacement therapies for so many other reasons. But that has also been found to be a modifiable risk factor for breast cancer. Yeah. So basically, if you consider them as modifiable and non-modifiable, then you would know what to do and how to avoid certain risk factors.
Wow, that's amazing. You had talked about sometimes even if someone doesn't experience pain, like it doesn't mean that the person does not have breast cancer. So could you please tell us like some of the early warning signs or symptoms that people should watch out for?
Okay, so let's start with the breast lump. Okay, so the breast lump is also known as breast mass. So what that means is you will feel something like a stone. Okay, so maybe not even a stone, but something that was not there. And so when you start seeing that, sometimes it's a benign condition. Benign condition means it's something that would not cause you problems. It's not cancer. Okay, but once you start seeing something on your body or on your breast that was not there, especially if you have some of these risk factors that we have mentioned, then you have to be careful and you have to seek attention immediately, because early detection saves lives. So a new lump, something that was not there before, or even thickening of the breast, so it's the skin, or you feel like your breast tissues are thicker than they used to be, especially if it's just one breast, right? The other breast is not affected, then you have to go and seek help. So the other symptoms or signs, the other things that one would look out for is the change in size and shape of the breast. Now, naturally, the breasts are not equal in size. So one is a bit bigger than the other. But when this discrepancy in size is big, like it's very obvious, whoever looks at your breast, because usually it's not something that people notice. So they can just, naturally, usually one would really have to observe very well for them to notice that the right breast is bigger than the left breast, or the left breast is bigger than the right breast. But if it is so obvious that whoever looks at your breast, they know that your breast, that one breast is a lot bigger than the other, then that is also a sign or a symptom of breast cancer. Now, people also have nipple discharges when they have breast cancer. So we know that the nipple is not supposed to be discharging unless you are breastfeeding. Okay, so when you are breastfeeding, sometimes even if you're not breastfeeding, you could see some discharge on your breast. But once you start having these discharges, then you have to go and seek help, especially if it is bloody discharge, right? So if the discharge is milky or it is colorless, I'm not saying you shouldn't seek help, but if it is bloody, then you should go and seek help as soon as possible. Sometimes it's the skin itself that changes. So you have what we call skin dimpling. So it would look like an orange peel, you know, the peel of an orange, right? So we all know what oranges look like. So when you see those spots on your breast, then that's also one of the signs of breast cancer. Now, if it's not caught early, then it could also ulcerate, like it forms an ulcer, and you would see that the skin is no longer there. That could be one of the presentations of breast cancer as well. Then the lump that we spoke about on the breast could also be under the armpit, especially the armpit of the same breast. So if we're talking about the right breast, then you could have a lump or you could feel something on your right armpit as well. So that's also one of the ways by which breast cancer can present.
So we've always hear like early detection save lives. Could you please elaborate like why early screening makes such a big difference?
Yeah, so early detection does save lives. The reason is because this uncontrolled growth of cells, once you catch it early, you can do something to stop them from growing, or you could even do something to remove them from the body entirely. But when it is caught late, these cells do not only stay on the breast, they move elsewhere. They could go to the liver, they could go to the brain, they could go to the bones, they could go to everywhere else on the body. Okay, so that's why catching it early is very, very important, because even if it comes to the surgical treatment, when it is late, like for example, when it has gone to the liver, even if you remove the cells that started the problem, it's already gone to the liver, and you can't go on chasing everything. Right? So it means you would have to go and remove one's liver. And people cannot live without a liver. Right? So if it goes to the brain, for example, and the size becomes so big, you cannot do anything to remove it from the brain. So the more you wait, the worse the prognosis becomes, the worse the outcome becomes. And that's why we always emphasize on early detection. Catch it early, and you can get help to get rid of it. Some people have been cured from breast cancer because they were caught at a very, very early stage. It just started, it was caught, and it was removed. And you see them, you wouldn't even know that such a person had ever suffered from breast cancer. But unfortunately, we see a lot of late cases. And at that point, it even becomes more painful, okay? Because initially when it starts, it's painless. The mass is painless when it starts. But if you don't do something about it, it starts growing bigger, it starts pulling on tissues, it starts compressing on other organs around, and you start feeling pain. And the pain is unbearable. That's the scary part of it. You can take all the pain medications in the world, and still you will be having this constant pain from breast cancer. It's very, very painful. So that's why we always emphasize on early detection.
I can't imagine the struggle that some of these survivors have actually gone through. The sound of it alone sounds very, very painful and difficult. And that brings us to our next question, like how common is breast cancer in the Gambia, and have you noticed any trend over the years?
Yes, so when you look at the literature around the world, they will tell you that breast cancer is extremely common, okay? So the Gambia is not an exception. In fact, when it comes to cancers in the Gambia, it's only second to cervical cancer. So it's like one of the most common cancers in the Gambia. So we see patients who have breast cancer a lot. And we've also operated a lot on breast cancer patients. So the trend has been changing, unfortunately. 20, 30 years ago, it's only elderly women who would come with breast cancer. But now you see very young women who are coming with breast cancer. So the more reason why we have to create awareness and educate ourselves, sensitize one another on these issues. So it's actually a very common condition.
So sometimes most patients are usually scared of how the diagnosis is being done at the hospital. And it could be one of the reasons why some people do not report to the hospital. So could you please explain to us, like, what are the screening options that are available, like, locally? At what age should women start getting screened for breast cancer?
Okay, so when it comes to the age at which people should start screening, the general advice is after the age of 50 years and above. But if someone has a risk factor, let's say someone has a mother who had breast cancer, then they are advised to come even earlier. So they could start their screening at the age of 20. Okay. Likewise, someone who has a sister or someone who even had breast cancer before. Okay. So because one of the risk factors that we didn't mention is having a history of breast cancer before. So if someone had, let's say, breast cancer on the right and it was cured, that means that there is a higher risk of them developing breast cancer on the left as compared to someone who never had breast cancer. So people like that are urged to be on follow-up, and they're always advised to go to the hospital for screening to check on the other breast, whether that other breast has breast cancer or even a recurrence. Right? So sometimes you could treat breast cancer on one breast, but then after some time, after years, it would come back on that same breast. So it's important for them to be on follow-up or to be screened. Now, when it comes to the screening options, we have what we call clinical screening, and that is based on experience. So the doctor is able to do a physical examination. They can examine one's breast, looking for signs of breast cancer. Once they see these things, then they move a step forward. They go ahead and do investigations. So investigations would include imaging. Right? So you have breast ultrasound, for example. One could be asked to go and do a breast ultrasound scan, and the scan is able to see some of these breast cancer cells or breast cancer changes. Now, mammography is also an investigation. It's also an imaging modality, which is not quite readily available in the Gambia, I must say. We have one in the hospital, but it's something that goes on and off. Sometimes it's available, sometimes it's not. But ultrasound is readily available. The ultrasound scan is always there. So once the doctor suspects that there is breast cancer on one's breast, then they send them to go and do an ultrasound scan. Now, the ultrasound scan also has a way of stratifying them, categorizing them into people who are having masses or lumps findings that are more suggestive of breast cancer versus those that are suggestive of something else different from breast cancer. So when they have a high suspicion from the ultrasound scan, then they would advise the doctor to go ahead and confirm the diagnosis. And this is done through histology, or what that means is cells would be taken from the suspicious area and then taken to the lab. Then the lab scientist will look at it, and then they will be able to tell whether this is breast cancer or not. And that is the definitive way of diagnosing it, because your clinical judgment can only raise your level of suspicion. Your scanning could also do the same, but ultimately the one that confirms that this is breast cancer is the test that is done at the laboratory, which we call histology. So all of these things that I've mentioned are actually available in the hospital. So when we see patients, we examine them. We also teach them how to do self-breast examination, because that is one way of catching it early. Once somebody knows how to do a self-breast examination, and they are used to the normal feeling of their breast. Once they start seeing something different, they are able to notice it and they can seek help. So clinical examination, then we move on to do investigations, including imaging, that is breast ultrasound scan or mammography, and eventually histology, that is taking a sample from the breast and take it to the lab to have a look at it. I hope I am not going into too much medical terms there.
No, it's not. It's not. It's actually it's really good that we get to have all this information, because I've seen some people that be really scared to go to the hospital. So we appreciate you giving us all the details.
Right.
Yeah. So that takes us to the next question, like, what advice or message would you share with women who are scared to go for screening because they fear what they might find?
Yeah, so the general advice is that, like we said, early detection saves lives.
Right.
So if you are scared of screening, then it means you're putting yourself in a position whereby even if you have breast cancer, it's going to be detected late. And we've already spoken about all the negative things or all the possible bad outcomes from detecting breast cancer very late. We spoke about the pain, the unbearable pain, and the fact that it would have already spread to other parts of the body. So it only emphasizes on early detection. Get it early. Forget about what you are scared of finding, because if you don't know the problem early, then you're going to be at the risk of developing it late. Okay, so it's better to know it early and deal with it than to find out late when there is little or no solution at all. So I would advise people who are scared to face their fear and go and have themselves checked. Because if once you are cleared and you are taught how to do these things, then you're even more comfortable doing it yourself at home. But if you're someone who is refusing to go at all, you're not even taught how to do it, then the chances of you developing it and presenting late are high.
I know making such decisions can be very tough. It can be quite draining, and some people are quite scared. And if you know you're in that kind of position, please reach out to us or reach out to Gap Health Technologies, and we're going to lace you with a trusted provider that is going to help you make the best decision for yourself. So, and you just have virtual consultation before you go to the next step. Okay. All right. So, Dr. Zeka, are there lifestyle habits that can reduce the risk of breast cancer?
Yeah, so we spoke about the non-modifiable risk factors, but we've also talked about the modifiable risk factors. The non-modifiable risk factors, we said there's nothing that can be done about them, but the modifiable risk factors, we are in control. So we can decide to always be eating and not having exercise, living a sedentary lifestyle, using hormone therapies. These are things that we could say, yes, I want to do it, or I don't want to do it. But generally, of course, people are always advised to do something that is better for their health. So exercise is something that we are all advised to do. Avoiding alcohol, smoking, these are modifiable risk factors. These are things that we could say, look, I don't want to drink alcohol. I don't want to smoke. I don't want to come around people who are smoking, because some people do secondhand smoking. So they won't smoke, but they would always be around people who are smoking. In fact, there are reports that say that secondhand smokers are even worse than people who are smoking. So avoiding these things are some of the things that we could do. So the same thing for hormone replacement therapies. Some people just like the idea of taking hormones, let's say for bodybuilding, or because they think they are thin and they want to get fat, so they are into all of these things. But by and large, these are the things that we could control and they're called modifiable risk factors.
And we can see the increase of that even in the Gambia, people taking hormones just to gain weight. So, yeah. So, like, what are some of the common myths about breast cancer recovery or treatment that you would like to correct for the public?
Yeah, so some people think that when you have breast cancer, it means that's the end of your life. No, that's not the end of your life. In fact, when you have breast cancer and you catch it early, you can be completely cured. Completely cured, meaning there are no breast cancer cells left in your body. Okay, so that's one of the myths that people need to understand. Then the other thing is that there is no treatment for breast cancer in the Gambia. So some people are hesitant to come to the hospital when they are told they have breast cancer. They start looking for funds to go to, let's say, Europe or even Senegal, because they think that places like that would even have better treatment options than in the Gambia. We have treatment options available in the Gambia. So recovery is possible. People have survived it, and they've even joined advocacy groups to help create awareness and to support people who are suffering from breast cancer. So it's not only a disease of the elderly now. Okay, we have young people, and I keep emphasizing that we have very young people who are coming with breast cancer. And it's not only familial. It's not only people who have it in their families that will develop breast cancer. Sometimes it could just happen like that. And these are things that people have to be aware of.
So, Dr. Seka, with your experience in interacting with patients like that have experienced this condition, like what are some of the biggest challenges they face during recovery, or how can we help them to overcome those?
Wow, that's a very important question. It's not easy dealing with breast cancer because there are so many negative ideas around. Okay, you would hear so many things, and people will tell you, go to this person, go to that person. We know our environment, and we know how some people think. They will tell you, you need to go to see this Marabu. This is not a disease that is supposed to be treated in the hospital. And at some point, you get confused because you would have people who are educated, okay, very educated people, and yeah, they are diagnosed with breast cancer. You talk to them, and they are willing to listen to you, but they will tell you, look, I think I have to go and discuss this with my family. The next minute, they're back and they tell you, no, I'm not going to do this treatment. I don't want to do this. They've told me about such a person, and she had breast cancer, but when she went to this man, they gave her something and she got cured. That's how you lose them. So, I mean, it's very difficult dealing with the situation itself, just the psychological trauma that people have, right? Okay, thinking about breast cancer the whole day. Right? So some people, you even start talking to them about their breast lump. You start telling them that, look, mom, I think this thing, we need to investigate it because the way we see it, it may look like breast cancer. Once you start saying those kind of things, you see how worried, how scared they are. Not even breast cancer that has been confirmed, just suspicious breast cancer. You see the change in their face, and I mean it's a lot. Okay, so recovery and dealing with it is a problem as well, because one of the treatments is what we call mastectomy, and that means you would have to remove the entire breast. And we know that women sometimes are targeted because of those kind of things. Right? So once people know that one of your breasts was operated on and was removed, you know, they start labeling you as someone who's not a woman, and they start calling you names. And these are challenges that are real, and women have to battle with these kind of things all the time. Then when it comes to the treatment also, there are risks. I mean, there are factors or there are side effects of some of these treatments that would go on and affect women. So, so these drugs that are called chemotherapeutic agents can be very powerful. So once somebody starts taking them, they could get weak. Okay, so imagine you're struggling with this cancer, and you are the only one at home. You're doing the chores, or even if you have people that you're sharing the chores with, and they may not understand, right? So that these medications that you're taking are making you weak, and they may think that you're just trying to avoid work, and that would add to the stress that you already have. So sometimes it could also lead to one's hands changing in color, and they become dark, like very black, and that's because of the medications that they are taking. Or sometimes they would lose their hair, right? And we know women and hair, they love their hairs, right? So somebody has breast cancer, they start taking these medications and they start losing their hair. I mean, they don't want people to see their hair and all that. So it's a big battle. It's a really big battle. But I mean, if you're strong and you have very good family support and very good psychological support as well, you're always able to deal with these problems. You're always able to deal with all these issues.
That's a real struggle for patients that go through this. And sometimes having that family support, it can be quite tough, yeah? I would like to know, the entire public know, this is where Gap Health comes in. We have doctors, we have nurses, we have mental health providers. You're not alone, and we're here to support you. We're here to help you take charge of your health, for you to be strong again, and for you not to feel like you're battling all these struggles all by yourself. I feel really bad to know that people go through all this pain, honestly. So, like, how can we encourage to have more open conversation about breast health, especially in cultures where it's still a sensitive topic, like in the Gambia?
Yeah, so people just have to be sensitized. We have to educate ourselves and educate everyone else that when it comes to health, you can't be shy to seek help, okay? We know that the culture that we have promotes shyness, but when it comes to health, you just have to put it away, put it aside, and go and seek help, because at the end of the day, if you don't, you're just harming yourself. So we have to encourage these topics to be discussed in bantabas, to be discussed at the family level. People could sit down and talk about breast cancer and talk about changes on their breast, and nobody would look at them in a certain way. Okay, so especially if you have siblings who know one or two things about these things, you could approach them and talk to them about it. Spouses should be able to discuss this freely, right? So let's say that the wife has seen changes on her breast, she should be able to look at the husband and have a conversation, a normal conversation with the husband, just like any other thing that she would have to discuss with the husband. So creating awareness, sensitizing each other, and encouraging one another to go for early screening, and also to look for treatment when we are diagnosed, avoiding denial. So some people have that problem. You tell them that this is what you have. They tell you, no, it's impossible. How can I get breast cancer? I mean, I don't have anybody in my family with breast cancer. I am young, I am this, I am that, so it's impossible. So they keep denying the fact that they have this disease until it's very late. So yeah, if we're able to normalize these conversations, I think that would go a long way to helping to create awareness.
I think getting the men's support also will play a vital role. So, like, what role do you think they could play in breast cancer awareness, and why is it important for them to be part of the conversation as well?
So I started off by saying that people think that only women can have breast cancer, but men can have breast cancer. Yeah, but the risk is very low, okay? So it's just 1%. 1% of people who have breast cancer are men, so it's not high at all. But the thing about men having breast cancer is that because they don't have a lot of breast tissues, when they have breast cancer, it doesn't have much space to grow. And so by the time they present to the hospital, it's already late. It has already metastasized, meaning it has already spread to other parts of the body, and it becomes much more difficult to treat. Now, the reason why I am saying that is for men to also take note that this is not a disease of women alone, because most of the time, let's face it, if it's something that only affects women, it's a very bad practice, but most men wouldn't have any interest in such things. But of course, at the end of the day, if one woman has breast cancer, it's somehow it will always affect the general population. So let's talk about the financial aspect of it. You would start looking for paying for investigations. You would start doing certain tests. You start buying medications, going to the hospital. So even if it's your wife or let's say your sister, and she's the one who has breast cancer, she is going to need your support in one way or the other. So you can't allow them to deal with all that stress alone. So they have that psychological issue already. You don't support them. You don't give them that emotional support. You don't give them that financial support. You're not there for them. It makes it much more difficult for them to recover from this disease. So men have a very, very big role in creating awareness and also supporting people who have breast cancer.
Absolutely right. So before we close, I would like to tell our audience that we would love to hear from you. Like what you think of today's session, what would you like to see be done like differently, or what we should include in our future health events. Please let us know in the chat box, both on Facebook and Zoom. So our final question, Dr. Seka, what is one powerful message you would like everyone to watch today to take away from this event?
Thank you very much, Ajua. Unfortunately, I think today is going to be the last day of October. The entire month of October has been dedicated to create awareness about breast cancer. But that is just for us to give more attention to breast cancer, but that doesn't mean that creating awareness should stop when the month ends. So this is something that everybody has a role to play in. We have to always be on the lookout. We always have to educate ourselves, sensitize the people around us, and normalize these conversations. And people who have changes on their breast that were not there, I would advise them to always go and have it checked out, because the message is very clear. Once it is detected early, it can be treated. So early detection, we say, always saves lives. So thank you so much for this opportunity.
This was insightful. Thank you so much, Dr. Seka. And we have Hadi say it was an insightful session. I have learned a lot from it. And Naomi, I am definitely learning new things, including myself. So we would love to hear from the audience. Do you have any question? Please do not let Dr. Seka go like that. Make the best use of it. He's very busy. Any question? Very insightful. Thank you, Emanuela Asiedu. Okay.
I'll go. I just want to say thank you very much, Dr. Seka, for the session. I've been taking a lot of notes. I always say this during our Gap Health events. I think I know quite a bit in terms of about the disease and sharing that with my friends, but I think there's a lot more that I learned from this, so appreciate it. Something that I also wanted to point out is there's something around, me as a woman inviting men to the conversation, but there's something around you as a man actually inviting men to the conversation. So thank you for doing that. I did see you have a pin on as well, so keep up that conversation. I wanted to ask more specific around the research perspective. So you talked a little bit about how overall in the research around the world, there's a high prevalent with older women, but you've seen that to be contrary in Gambia. Can you talk a little bit about that research? Where is it at? Do you think there's opportunities for improving, and what would you like to see in that space?
Right. So I think we have to do better as an institution when it comes to research. I'll admit that these things that I spoke about are observations. Okay, so these are things that we have seen from observations, but not necessarily things that we have researched about, like consciously writing research questions and going on to find out about their risk factors and all that. But it's been noticed that we've been seeing patients who are about 30 or even 20 years of age, and they are coming with breast cancer. But I cannot really recall having a published research paper highlighting this. So I think it's a challenge that we will take up, inshallah, and work on it.
Just to let you know, we do not only focus on telehealth, that is Gap Health. So we also have a platform where one can conduct research. As we speak right now, we are partnering with Tufts University in the United States. They're conducting a research in Ghana regarding hypertensive patients. They're focusing on patients that have smartphones and the ones that do not have smartphones. So whatever kind of research that you want to conduct, anything that has to do with healthcare, please reach out to us. You can check us out at gaphealth.ai or check us out on our Facebook page at Gap Health Technologies and reach out to us. You'll hear from us, both from Ghana and the Gambia. Yeah, we'd love to work with everyone. And we just want to make healthcare more accessible to everybody, to help people take charge of their health, to increase the people getting better, people having strong health and all that, yeah? So we have another one, Mrs. Monica. I said, thank you for this informative session. A question to doctor. He informed us that normally it affects the elderly, but also informed us about 20 years coming in. So I would like to know, when is best to go for screening?
Yeah, so an interesting question. Now, I did mention that we have different ways of screening. One of them is clinical examination, physical examination. So breast examination is one way of screening. This doesn't require anybody to wait until they are 50 or until they are 60. Right? So once it's established that they have breast that has grown adequately, because we're not talking about people who are still in their adolescent age and the breast is still growing. But once they've started seeing their menses regularly, then they could go to the hospital and have it checked by a professional. Now, the professional could also teach them how to do it at home, and that's the good side of it. So once they learn how to do a self-breast examination, they could do it at home, okay? And that's one way of screening. Then the other thing is about ultrasound scan. So if you have a risk factor, you have a family member who has breast cancer, you don't have to wait until you're 50. Start early. Go as early as 30 years of age and explain to them that I have a risk of developing breast cancer because of A, B, and C, and that's why I am here. And they will take it up. So when it comes to the histology, that one has to be supported by clinical evidence. Like it means somebody must have felt or seen something that they suspect to be breast cancer, and then they send you to do an ultrasound scan or another form of imaging. And then the imaging says, yes, we actually think this is breast cancer and needs to be confirmed with histology. So basically, that's my advice. We don't have any, we don't have a rule of thumb that one has to go to to the hospital for screening at the age of 30 or 40 or something like that. But generally, we encourage everybody to learn how to, at least learn how to do self-breast examination at a very early age.
Yes, thank you so much. I hope that answered your question, ma'am. Do we have any other question? Do not let him go. Okay, no. All right, so we will close the curtain down here. Thank you everyone for joining us today and for being part of this important conversation on breast cancer awareness. And I would like to extend a special thank you to Dr. Pa Samba-Seka for sharing your expertise, your insights, and your encouragement. To all our participants, remember that awareness is the first steps towards prevention. Early detection saves life, and no one must face this alone. So whether it's getting screened, supporting a loved one, or spreading knowledge in your community, please go ahead and do that. Like, every action counts. So we would also want to remind you that at GAP Health, we are here to support your health journey. Our platform makes it easier to book virtual consultations, access reliable medical advices, and take charge of your well-being, all from the comfort of your home. You can chat to us on WhatsApp at +22072979967 or +23359411185. So remember to follow us on Facebook at GAP Health Technologies for health tips and resources to help you and your loved ones stay healthy. And be sure to mark your calendar for our next virtual event on November 28th. We would love to see you all. Thank you once again for joining us, and have a wonderful day. Bye.
Bye.
Thank you.
All right.